Using extensive scientific study into daily life, our objective is to demystify the scientific evidence that supports the idea that physical activity has a positive impact on healthy aging. The scientific rationale behind the relationship between physical activity and longevity. Through the utilization of extensive scientific research and in-depth analysis from industry professionals, this will investigate the connection between physical exercise and longevity. In addition to providing actionable ways for incorporating physical activity into daily life, our objective is to demystify the scientific evidence that supports the idea that physical activity has a positive impact on healthy aging. Physical activity has several physiological side effects. Participating in regular physical activity has a significant impact on several physiological systems, which in turn improves general health and lowers the chance of developing chronic diseases. The cardiovascular system benefits from physical exercise because it improves the variability of the heart rate, increases the flexibility of the blood vessels, leads to improved blood pressure sensing, and improves the function of the heart and blood vessels in middle-aged people. Additionally, physical activity is connected with improved cardiorespiratory fitness and is beneficial to the function of the respiratory system. There was a favorable correlation between moderate and vigorous physical activity and lung function, according to the findings of one study. This was the case regardless of whether or not the subjects included smokers. It is beneficial to the musculoskeletal system to engage in physical exercise since it results in increased bone mineral density and, as a consequence, lowers the chance of developing osteoporosis. In addition to this, it improves flexibility, glucose tolerance, and the capacity to successfully carry out activities of daily living. A significant reduction in systemic inflammation, which is a crucial factor in many chronic diseases, can be achieved with regular physical activity. The reduction of fat mass and inflammation in adipose tissue, both of which are substantial contributions to systemic inflammation, is provided by exercise. Even moderate levels of physical activity have the potential to reduce inflammatory biomarkers and mobilize T cells in muscles that are capable of combating inflammation. According to the findings of a study that was carried out in Japan, individuals who reached the age of centenarians or semi-supercentenarians did have longer telomeres. However, the levels of inflammation that they had were a significant component in successful aging. Influence on chronic diseases. Exercise is one of the most effective ways to reduce the risk of developing chronic diseases like cancer, diabetes, and heart disease. It is possible to reduce the risk of developing diabetes by engaging in physical exercise for a total of 150 minutes each week. Increases in body mass index, BMI, can further reduce the chance of developing diabetes. It is possible to minimize the risk by as much as 30% by engaging in greater levels of physical activity. People who are more physically active or fit are less likely to acquire coronary heart disease than those who are sedentary, according to several papers that have been published by the American College of Sports Medicine and the American Heart Association. These investigations have demonstrated strong evidence to support the notion that more people are physically active or fit. A reduction in the risk of bladder cancer by 13%, a reduction in the risk of colon cancer by 19%, a reduction in the risk of endometrial cancer in women by 20%, and a reduction in the risk of breast cancer by 21% in premenopausal and postmenopausal women are all connected with activities that involve physical exercise. In addition, other research has demonstrated that engaging in physical activity reduces the likelihood of developing malignancies in the kidneys, stomach, and esophagus. In addition to greatly increasing life expectancy, physical activity is an essential component in the management of chronic diseases. People who are 45 years old and have 2 or more chronic illnesses and who engage in high levels of physical activity have a mortality risk that is 14% lower than those who engage in low levels of physical activity. In addition, people who engage in physical activity have the potential to increase their life expectancy by up to 3 years when compared to those who do not engage in physical activity. Reducing symptoms of despair and anxiety, which are prevalent concerns for individuals suffering from chronic diseases, is another benefit of engaging in physical activity. Longevity and aerobic exercise are similar. Through the development of the heart muscle and the improvement of circulation, aerobic exercise facilitates the promotion of cardiovascular health and endurance. The ability of the heart to pump blood effectively is improved, blood pressure is lowered, and the resting heart rate is lowered when aerobic activity is performed regularly. It has been discovered that engaging in activities of moderate intensity for more than 3 hours per week can reduce the chance of death by 27%. Additionally, an additional reduction in mortality risk can be noticed when engaging in severe exercise for 20 minutes 3 times per week. At least 150 minutes of moderately intense aerobic activity or 75 minutes of strenuous aerobic exercise should be performed by adults every week, according to the guidelines issued by the American Heart Association. Longevity and strength training are related. There are numerous advantages to strength training, including the maintenance of bone density, muscular mass, and metabolic health. Throughout their lives, older persons can dramatically enhance their muscle strength with resistance training, which is essential for preserving their independence and everyday functioning. In addition, strength training helps improve bone density, which in turn lowers the risk of osteoporosis and fractures. Weight-bearing activities are particularly beneficial for postmenopausal women and older individuals because they encourage bone development and slow bone loss. Both of these benefits are especially essential. Strength training helps increase insulin sensitivity and glucose metabolism, helping to prevent and control type 2 diabetes. Strength training also helps to improve insulin sensitivity. Additionally, it increases the rate at which the body burns calories, which helps with weight management and lowers the risk of metabolic syndrome, particularly in older women. On a practical level, the guidelines for implementing strength training include targeting key muscle groups at least twice per week and doing so at least twice per week. During each set, you should execute 12 to 15 repetitions, gradually increasing the weight and resistance with each repetition. Contrast moderate activity with vigorous activity. Activities that are moderate in intensity and robust in intensity both have health benefits, including a lower risk of mortality and enhanced cardiovascular health. Walking at a brisk pace or cycling at a speed of less than 10 miles per hour is an excellent way to reduce blood pressure and enhance cardiac function. More than 10 miles per hour of running or cycling gives comparable advantages, but in a shorter amount of time due to the increased intensity of the activity. It was discovered that the total amount of physical exercise, independent of the type of activity, is connected with a significantly lower chance of dying prematurely. By using speed intervals, walking routines, or alternating between moderate and vigorous exercises throughout the week, you can achieve your fitness goals. Techniques that can be implemented to boost levels of physical activity. To overcome obstacles to physical activity. The practice of incorporating physical activity into our daily lives. Numerous activities can be utilized to include physical activity into daily routines to achieve this goal. For instance, people can reduce their risk of cardiovascular disease by 11% by walking or riding their bikes to work. This has been demonstrated to be an effective method. It is vital to set little goals, such as striving to take an additional 500 steps every day for a week, and then raising that number by another 500 steps the following week to avoid becoming burned out. The process of adapting physical activity to the specific requirements of each individual. Final thoughts. The key to a long and healthy life is to engage in physical activity regularly. Much scientific data supports its several benefits, which include improved cardiovascular health, greater respiratory function, higher bone density, and lower inflammation. These physiological benefits make a substantial contribution to reducing the chance of developing chronic diseases such as cardiovascular disease, diabetes, and a variety of malignancies. Strengthening the cardiovascular system and lowering the chance of death are two benefits that come from engaging in regular aerobic exercise, such as walking or cycling. By combining aerobic exercise with strength training, older persons can improve their muscle mass, bone density, and metabolic health, which in turn further supports their independence and overall well-being. Although there are numerous advantages to engaging in physical activity, incorporating it into one's daily routine can be difficult due to frequent obstacles, such as a lack of time, motivation, or resources. Making physical activity more accessible and sustainable can be accomplished by addressing these problems through the implementation of practical solutions. Some examples of these tactics include creating small, attainable goals, incorporating activity into normal duties, and adapting exercise routines to individual needs. If you found this information helpful, don't forget to like, subscribe, and leave a comment below. Your support helps us bring you more valuable content.